As you can see by this video, HIV patients are very, very vulnerable to TB just because of their immune status being so compromised. So a lot of the current patients that we see with TB, it's almost considered nowadays it's an opportunistic infection that you'll see with HIV patients. On page 80, we're still referring to our drugs. Because people have been treated for TB and are in a situation where they cannot always keep up with their treatment, unfortunately, a lot of strains of tuberculosis are often resistant to the treatments that we have. When you're talking about people who are homeless, people who are in prison, people who live in very crowded conditions, many times they're transient and they can't stay in one place and get the help that they need. So we're talking people who don't complete treatment, and like all the antibiotics and all the pathogens, if you expose the TB bacterium to drugs, they're going to mutate in response. And so what we've ended up with are a lot of resistant tuberculosis cases. The adverse reactions to many of these drugs are drug specific, and it's very important that you read the text on pages 79, 80, 81, because you will see how each of these drugs work and the side and adverse reactions you can expect. These drugs can be toxic, and so they can affect various body sites. And like I said, most of these medications are going to be given in combination therapy, not just one drug. There are a few drug-specific symptoms that you can warn people. Ethambutol can cause some vision issues. So if somebody's on that drug, it's important that they are following up with an eye doctor. And with rifampin is a drug that's not only used for tuberculosis, but also for some other pathogens. And so you always need to warn people that their urine can turn reddish orange, their perspiration can turn reddish orange, and they should not be surprised when they see discolored body fluids. These drugs have various interactions, and like a lot of other drugs, when people with TB are getting their follow-up, they really need to sit down with a healthcare provider or a nurse who is heading up their treatment and look at what medications they're taking, get the product package insert out, and look at how each of these particular drugs is going to interact with drugs that they are taking. What does this mean for us as nurses? We need to be aware of the signs and symptoms of TB. Some of us will work in areas where TB is more likely to occur. Those of you who are going to go on and work in maybe a prison system, maybe going to work in long-term care centers, you might be a little bit more susceptible. So know the signs and symptoms. You will have to take TB tests for screening, and know that a positive result, which is going to be a big red raised wheel on the arm where the injection was given, it only indicates exposure. It does not indicate necessarily an active case of TB. To diagnose it, you have to take a thorough patient history, find out who they've been exposed to, what the risk factors are, and it takes a chest x-ray, blood draws, other kinds of labs, and often they're done weekly to follow the course of the illness. Also sputum samples, and generally you're not considered free of TB until you have 3 consecutive negative sputum samples. When it comes to planning for nurses, they have to take into consideration their patient's length of treatment. Included a link here from the CDC talking about TB law in various places. TB is a reportable illness, which means that if a healthcare provider becomes aware of a case of TB or a case of suspected TB, it has to be reported to the health department. We have various degrees of success in keeping track of TB patients depending on the laws in their various states. And there are a lot of civil rights issues that are brought up as far as trying to keep people in their homes and not exposed to other people when they are first being tested and treated for TB. For implementation, we have to be familiar with the patient's dose and give them patient teaching on how to use their particular drugs. And then, of course, evaluation, continued chest x-rays, continued labs, and those 3 negative sputum samples. On page 83 in the text, we see patient and family teaching for these tuberculin drugs, and you can see that there are quite a few bullet points here. So read them over very carefully, and also go to pages 80 and 81 and read about side and adverse effects of and nursing implications for these particular drugs.